Tonight, we begin a series of reports that many of you have been asking for. A deeper look into the accusations of MaineCare fraud against Gateway Community Services.
Gateway is a for-profit healthcare provider founded and run by Somali-American immigrants. It offers counseling, case management, behavioral health, home services, and more. MaineCare is the state's version of Medicaid, government-provided health insurance for lower-income people.
3 different audits by Maine's Department of Health and Human Services has found Gateway overbilled MaineCare by a total of more than $1.6 million from 2017 to 2022. In the last 5 years, the state's MaineCare program paid it $28 million. Republicans in Maine's legislature tell us they are frustrated with how long it has taken to find potential fraud. Our Chris Costa spoke with one of the state's top Republicans about this. Joins us now live. Hi, Chris.
Hi, Brian and Amanda. So I spoke with Senator Matt Harrington. He's the assistant Republican leader in the Senate. And so this week I'm going to be bringing you a series of question and answer exchanges that I had with him. He thinks that the state, one, is not taking the claims of fraud seriously. He also feels that the state is not properly staffed to do these investigations. And he also feels that the Attorney General's office should be moving more swiftly. Now, we know that the Department of Health and Human Services has sent this case to the AG, but the AG won't confirm if it's investigating. It's credible, that's why it's with the AG's office, and now needs to be, for lack of a better term, adjudicated, processed. Do you agree with that?
Yeah, I do agree with it, but I think, again, going all the way back, this has been a long time in the making. Mm-hmm. Going back, like I said, to the LePage administration that flagged this for the Mills administration that this company was overbilling. How long do you get? In no other sphere would you get to take money from the government, not pay it back, and just be granted absolute immunity. Just you don't have to pay it back. There's no timetable on when you have to pay it back. If you don't pay your taxes, how quickly does that become criminal? And what is the plan to recover that money if you keep continuing to allow that net amount to grow?
So we took those questions directly to the Department of Health and Human Services. Here's what they said. DHHS confirmed that Gateway has paid back the entire $125,000 in overpayment from the first audit. DHHS confirmed Gateway is appealing the other 2 audits. And Brian and Amanda, that audit process is long. We may not know the final decision and how much money Gateway owes for at least 3 more months. Now, DHHS did tell us it is normal for a provider owing a debt to continue to operate in MaineCare. In many cases, a provider will be on a repayment plan where they send a monthly payment to the department or have the department offset amounts against their MaineCare payments until the debt gets repaid. We also heard from Gateway spokesperson who told us for years Gateway has worked closely and transparently with regulators to improve its processes, provide requested documentation, and address issues as they arose. It will continue to do so. So Brian and Amanda, a lot more questions to answer on this case specifically. This reporting, just the tip of the iceberg. On Tuesday, we're going to dive into the number of staff that DHHS has dedicated to finding fraud, waste, and abuse in the MaineCare program, and why Senator Harrington believes, his colleagues believe, that there could be a link to the criminal cases of Medicaid fraud in Minnesota.
A lot more to come on this.
Yes, a lot.
Chris, thank you.
Yep.